want to make sure everyone is up to date with what the city is doing in terms of distribution and communication efforts. To receive ongoing vaccination updates from the Board of Health, please be sure to register at www.revere.org/vaccine-signup. In a moment, we will hear from Lauren Buck and Dr. Kong with an opening message from Mayor Arrigo. But first, I want to provide an outline and guidelines for tonight's meeting. This is a question and answer dialogue among Dr. Kong, Lauren Buck, and the public. To minimize technical difficulties, residents participating in the meeting are invited to type their questions in the chat function of your screen or email COVID-19@revere.org. Please try and be concise. Questions will be reviewed and relayed to both Lauren and Dr. Kong. When several questions address similar topics, we will summarize the questions and present that to our panelists as one question. If you have questions about the meeting or are encountering technical difficulties, please indicate that in the chat section as well, and we will try and address your issues. Now we begin tonight's meeting with opening remarks from Mayor Brian M. Arrigo. Mayor?
Thank you, Debbie. Good evening, everyone. And I want to start off by thanking Lauren and Dr. Kong for joining us tonight and taking the time to provide really important updates to our residents. Obviously, right now, our goal is to get all of our residents vaccinated. And as we make significant progress on vaccination, it's important that none of us forget that the virus continues to pose a threat to the progress that we're making and that we must remain vigilant. Both the President of the United States and the Governor have set a timeline that gets us to a large percentage of vaccination by the 4th of July, which the goal right now that's being put out there for the state and for the country is 70%. Of course, we're aiming for 100% with the key milestone along the way, 70% being one of those key milestones. To date, right now, 8,783 Revere residents have been vaccinated. With the clinic that is scheduled for tomorrow that Lauren will be heading up and spearheading, which we're very, very happy to do tomorrow. The Revere Board of Health will surpass the administration of 6,000 doses of the COVID-19 vaccine, which is a great milestone. And I know we have more to do, but I want to thank Lauren for her tremendous work on making that happen. Those vaccinations have happened at more than two dozen clinics that have been offered at the Rumney Marsh Academy. We've also had clinics on site at senior housing facilities, and we go as far as making house calls to our homebound residents. And again, I have to thank Lauren and her team for being able to do that tremendous work and getting that many doses in the arms of our residents and of other folks that are eligible to receive it. Some of our biggest challenges that we're facing today with the vaccine are around supply and access. And that's why it's so important for the residents to know that the Revere Board of Health will continue to serve as a vaccination provider as our supply allows, including at the upcoming mobile clinic, which I mentioned will be happening tomorrow for essential workers. Vaccination options for our residents have been further bolstered with last week's opening of a vaccination site at the Oceanside Lodge, also known as, for a lot of folks, the Wonderland Ballroom, right at Wonderland T Station. And that was opened in partnership with East Boston Neighborhood Health Center. And that clinic is doing upwards of 2,000 to 2,400 vaccinations a week. So we're really excited about having that stood up and the progress that will allow us to make. The team here, Dr. Kong and Lauren, are both going to give an update on some of the more details of what we're doing. Since the beginning of the pandemic, the emergency response team has provided a coordinated citywide response and is now leading our strategic path toward eradicating COVID from our community. And we're only going to be able to do that with the vaccine. So I will close by mentioning some of the resources that are available to all of us. I know we have a little graphic here. Obviously, as I mentioned, the Wonderland Vaccine Clinic that's been stood up with the help of East Boston Neighborhood Health Center is a tremendous opportunity for people to get vaccinated. So please call that number, 617-568-4870. You can also register online at that web address, bit.ly/EBNHCVAX. That, again, I cannot stress enough how much of an asset that is to our fight to get everyone vaccinated. We continue to have our local COVID vaccine hotline up and running. So if any residents have any questions, they can always call 781-286-8182. And please, if you aren't already signed up to get updates from the city about the vaccine, you can sign up at www.revere.org/vaccine-sign up. We have a lot of great resources that are available to our residents. We want to make sure that we're connected with all of our residents. And I want to end by thanking the team that's on the call tonight for the tremendous work they've done all through the last year. And as we move forward, it certainly feels like there's some light at the end of the tunnel, and that light is getting brighter and brighter every day with the work that these folks do. So thank you, Debbie. And it's great to see all of you, and looking forward to hearing from Lauren and from Dr. Kong.
I think I'm going next, right, Deb? Okay, awesome. Good evening, everyone. I'm going to be sharing some slides as usual. Right. So I just have some updates on COVID-19 for everyone this evening. First is the bad news. We obviously have come from so very far. 13 months ago is when this pandemic began, and you can kind of see where we've been, where we're going. And this is what worries me the most, is kind of where we're headed right this very minute. You can see the state of Massachusetts has had some ups and downs, some surges, 2 surges so far. The first being in the spring of 2020, and then the most recent surge in last winter, 2020, going into 2021. Right now, we're seeing the beginning of what I would probably categorize as a potential 3rd surge in our state. It would probably be the 4th in the United States. The Center for Disease Control and the White House, they're all cautioning against these increasing numbers, these concerning numbers that we're seeing. So even though the vaccine is getting out there, even though, as the mayor mentioned, we have a lot of amazing vaccine resources that that Lauren Buck will go over in just a few minutes. We're not out of the woods yet. So I just want to take a minute to urge caution among all the listeners this evening. Do not forget the basics, and that is that we have to still remain vigilant. All right. Even if you've already received a vaccine, please continue to wear a mask. Try to maintain social distance when you're especially in crowded areas, or especially if you're indoors, like at a grocery store. Continue to wash your hands frequently and avoid crowds or large groups. I know Easter is coming up, and that might be hard to do, but as best as you can, try to limit it to your own household, similar to the recommendations we had outlined for Thanksgiving and for Christmas celebrations and other holidays in the wintertime. Try to limit it to a small number of folks, try to limit it to just your own household. That's kind of the bad news, but there is some good news that I do want to share, because I've been getting a lot of questions about this from my own patients. And that is, what can I do now that I'm fully vaccinated? And again, Easter is right around the corner, so I want to make sure I try to make this as clear as possible, because it can be confusing. First off, fully vaccinated means that it has been at least 2 weeks after you've received your second Moderna or your second Pfizer shot, or 2 weeks after you receive your one and only Johnson & Johnson shot. So that is just a one shot, a one vaccine deal. So once you've reached that 2 week threshold, what are the things you can do? Well, you can gather indoors with other people who are fully vaccinated without wearing a mask. All right, so when you're thinking about your invitation list for Easter, you're thinking about some gatherings that you want to have in the near future, it would be good to assess who among your group of friends has been vaccinated yet so far. I will add a caveat that right now we're vaccinating only folks above the age of 60, but on April 9th, we'll start vaccinating those above the age of 50. And on April 19th, everyone in the state will be eligible. So again, a little bit of patience. I urge you to just be cautious and vigilant still. Just give us a little bit more time to get the vaccine out to as many folks as possible, and we'll get through this. But for now, some of the good news is if you've already been fully vaccinated, you can do that. You can gather indoors with others who are fully vaccinated without wearing a mask. You can also gather indoors with unvaccinated people from one household without wearing a mask. So for example, if I have a friend who lives next door and no one in that household is vaccinated, it's okay for me to go in there because I've been vaccinated, because that protects me from getting the virus from potentially that household. But I also am, I have the antibodies, I've been vaccinated, fully vaccinated, and it's unlikely that I am going to be carrying it into their home and giving it to them. Okay, so it works both ways, this vaccine. The vaccine will protect you from getting severe COVID, but it'll also protect you from being an asymptomatic carrier. So it'll prevent you from having it on you and bringing it to other folks. All right, and that's the value of getting this vaccine. The caveat to this, though, is that if there's someone in that household that has a high risk for a severe illness from COVID, say my next door neighbor has cancer, and they're getting chemotherapy, or they have severe lung disease, I can still go in there, but I should wear a mask. I should wear a mask, okay? What you can't do, what you cannot do, you cannot stop wearing a mask in public places, all right? This is huge. Just because you're fully vaccinated doesn't mean everything else we've talked about goes out the window. Please wear your mask in public places, at beaches, grocery stores, restaurants, parks, and other poorly ventilated spaces. Your workplace may have different rules, and other restaurants and other private properties may have different rules. So you obviously have to abide and respect those rules too if they want you to keep wearing a mask. You cannot stop social distancing in public places, all right? So, when able, try to keep a distance away from others. And you cannot gather indoors with unvaccinated people from 2 or more households, all right? If you're vaccinated if I'm vaccinated, I go to my next door neighbor's house, none of them are vaccinated, and then they invite our neighbor across the street who also is not vaccinated. Well, that's basically just kind of, going back to pre-pandemic levels of socialization. We don't know the COVID status of all those folks unless they got tested beforehand. So it's high risk to have us all mingling together inside without a mask. So try to take those gatherings outdoors where the ventilation is better, and obviously wear a mask. And the last thing is you cannot have large indoor gatherings. All right. We're still in the state of Massachusetts, about 34% of folks have received at least one of the COVID doses. and about 20% of folks are fully vaccinated. So that's still not a large enough number to get herd immunity. So it's still a bit risky to have large indoor gatherings. I also want to add another caveat. What about traveling? I get this question a lot too. The CDC officially recommends delaying any unnecessary travel, but if you cannot delay any travel, just do the things you've probably already heard about and are probably already doing, and that's to get tested before your flight. A lot of airlines and some hotels and some destinations are actually requiring this anyway, so I'm sure everyone's already doing this, but just try to practice that, and that's get tested 1 to 3 days before the flights. Try to wear a mask at all times. Sorry for the typo. Try to wear a mask at all times in the airport and on the plane. Maintain social distance when able. Obviously, can't do that on the plane. The seats are stuck where they are, but at least in the airport, try to do that when able. And then I would encourage you to get tested about 3 to 5 days after you return, just to make sure you have a negative test. Especially if you're unvaccinated, you want to make sure you're not an asymptomatic carrier of COVID and then giving it to your coworkers or your family members, or giving COVID out at the grocery store or something. This applies even if you are vaccinated, because again, though the vaccines are good, they aren't they aren't necessarily 100%. All right, so you just want to make sure we exercise all caution, because we're really not out of the woods yet, especially when I think about that first slide I showed and that uptick in cases. We're seeing case numbers go up. So just practice common sense and do the best you can to do your part to mitigate the spread of this virus. All right, that is all the slides that I have. I'm going to turn it over to Lauren, who's, I'm sure, going to answer everyone's questions. I know everyone wants to know about where you can get a vaccine and who's eligible. So I'm going to hand it off to our fearless leader.
Thank you, Dr. Kong. Lauren?
Thanks, Deb and Dr. Kong. So I'm going to pick it up from here and give you a little bit more an in-depth review of kind of what the landscape of getting a vaccine looks like here in our city. And from the last time that we all chatted in this forum, it looks quite different. I think it's looking a lot brighter for a lot of people. It's getting a little bit easier. It's still not the easiest process, but I'll tell you kind of where we're headed, what to look for. And I want to start by talking about the current phasing that Dr. Kong mentioned that still kind of dictates who can get a vaccine right now and what that's going to look like in about 2 weeks. So our current phase that is open is all of phase 1, which is, again, healthcare providers, healthcare workers, first responders, and then phase 2 workers are now eligible as well, which is essential workers like grocery store workers, retail workers, a very big section of the employment kind of category is open. Teachers and educators and school staff is open. Daycare providers are eligible. Those who are over 60 are eligible, as Dr. Kong mentioned right now. And those who have 2 or more medical conditions that are kind of on the state's website. And then once we hit April 5th, which is the day after Easter, 55 and over, so everyone who's 55 and older is eligible. Everyone who has 1 medical condition that's listed on the state's website is also eligible, as well as everyone I just mentioned. And then once we hit April 19th, which is a couple Mondays from now, general public is open, which means you are eligible to get a vaccine in the state of Massachusetts. If it's the Pfizer vaccine, you have to be 16 and over. If it's Johnson & Johnson and Moderna, you have to be 18 or over. And there will be no more kind of employment eligibility, medical conditions, or anything like that. So that's coming on April 19th. Now I'm sure you all want to hear kind of, if you haven't been able to get a vaccine yet, how to do so, what your options are, where you should be looking. And so I'm going to talk about a couple of different programs and a couple of different options and places for you to look. the mayor mentioned at the beginning of the broadcast here, there are a couple of resources, including our COVID hotline, including 211 for the state. These are all places you can go to find out about resources. But I'm going to tell you about some of the options right now, keeping in mind that the landscape of where to get a vaccine changes all the time. And so this is the most up-to-date information we have today. But things are changing every day and changing for the better, because more and more options are becoming available to us. So as the mayor mentioned, one of the big resources that we have in Revere now is the Wonderland Ballroom on Oceanside. The best way to kind of get an appointment there, to figure out what appointments they have available, is to either go on their website or call the phone number that was on the first slide of the presentation. The phone number is also known to the COVID hotline. If you call Revere, if you call 311 at Revere, or if you call the Revere COVID hotline. And also a lot of this information goes out regularly to the revere.org COVID information sign up form. So if you have signed up in that manner, you regularly get this information as well. So that's one of your options. Yes, and these are the phone numbers that we mentioned, and the sign up for the vaccine information is at the very bottom there. So that's one option. There's always still the option to go to the state's website, which has more options at they're calling them the mass vaccination sites, or the regional sites that are not necessarily in Revere, but close and around in the area, if you have the availability and the resources to go to a site that's not necessarily in the city. Those are always available to you, and the best way to look for those is to go to the state's website or call 211. Healthcare providers continue to provide vaccines to their patients depending on the stock that they have. So that's another option that's potentially available to you. It's not necessarily, again, every vaccine provider is based on the stock that they're given, but that is still an option, and that's something that you could consider looking into for your own healthcare provider. CVS, Walgreens, pharmacies are also an option. These pharmacies continue to get stock from the federal government and continue to give vaccines. The best thing to do is to look on the website or call 211, look on CVS's website, look on Walgreens' website. And then some of these locations are also listed on the state's website as well. But those places continue to get vaccine, and those will continue to be an option to get vaccinated. As a Board of Health, we've talked a lot about kind of what we've done up until now. I'm sure many of you are familiar with the clinics that we've put on not almost weekly. It has been weekly, sometimes more than once a week, since we have been able to get vaccine at the Rumney Marsh Gym. That option as a vaccination site will continue to run based on supply. The best way to find out about appointments and upcoming clinics that we have is to sign up on the Revere website. We update our subscribers with information about the clinics when we have them. The clinics that are run through Rumney Marsh are not necessarily on set days of the week or set times. They're based on the availability of stock that we have from the state, and based on kind of the workforce that we have available to us. We also sometimes try to plan our clinics based on days and times that work better for for people who continue to work during the day. And so we kind of vary our clinic times and locations. So there isn't a set day of the week at the Rumney Marsh Gym. And again, the best way to find out about upcoming clinics at that location is to call the COVID hotline, or to sign up for the Revere vaccine information kind of form. I also wanted to talk a little bit about getting a vaccine if you are homebound. I'm sure many of you heard that the state launched their homebound vaccination program last week. As a city, we've taken on the responsibility of vaccinating our homebound residents, and actually have been doing this for about a month now. We've vaccinated completely about 80 residents. which I know seems like a small number, but it's a very time-consuming process. And so we continue to work through our list. We continue to get referrals. And so if you're listening to this and you feel like you're not able to get out of your home to get a vaccine, we still have availability. Over the next month, we hope to reach most of our homebound residents. And you should be calling 311. Again, the COVID hotline. Those are both places to kind of reach out to us to let us know that you're interested, and we can walk you through what the program looks like and eligibility requirements for that. But that hasn't ended. We continue to move through that process. We work really closely with Revere Fire and go out in teams. And so over the next couple of weeks, we will continue to move through our homebound list to make sure that we hit everyone that we need to. But I wanted to make sure it's clear that as a city, we are vaccinating our own residents, and so the state's program for homebound residents is not an option for you as a Revere resident right now, because as a city, we are vaccinating our own residents. And then the last thing I wanted to talk about is the kind of the mobile clinics that we as a Board of Health are starting, and actually the state is starting them as well. And this is an effort to kind of bring the vaccine to where you are. And we are kind of kicking that off this week, actually tomorrow, by bringing a clinic to a hotspot for our essential workers. We will continue to do this throughout the next month and throughout the next couple months and throughout the summer, picking different locations throughout the city and working with our faith leaders, our business owners, and our Parks and Recreation Department to bring vaccine clinics to where you are. And again, the best way to find out about that is to subscribe to our social media pages and to sign up for the Revere COVID vaccine information, like I've been telling you about a lot already. And then the other kind of component of a new component is the state's mobile vaccine program, which also will be coming to Revere hopefully very soon. And that will just be another resource around the city. As a Board of Health, we will not be providing the vaccines, but the state will be running those programs. It's anywhere you can get the vaccine is as good as anywhere else. So all of these options above, nothing's better than any other option. So if it's available to you, if it's in front of you, take it, take the opportunity. In general, no vaccine is necessarily better than any other. Take any vaccine you can get as quickly as you can get it. And so all of those options are available to you. And the last thing I'll talk about is after April 19th, the general public opens. As the Board of Health, we will also focus on kind of outreach and trying and getting out into the community. And we've already started this process in terms of educating, answering questions, in the community, but we will continue to do so and try to reach people who might have hesitation, who might have questions. And we'll also be, focusing on educating and outreach and registering potentially right where you are for a clinic that we know of going on sometime that week. And that will be coming to once the general public phase is open. So those are all kind of that's what the landscape here in Revere looks like in terms of getting a COVID vaccine. And I will pass it back to Deb for questions. Thank you.
Thank you, Lauren. You certainly covered that. So a couple of questions we've been getting on the computer. One of them, the first one, it's kind of a two-part. So I'm hearing on social media that the vaccines aren't safe. I don't believe it, but my parents do. How can I convince them of the safety? And honestly, let me go into the next part. Is the Johnson & Johnson vaccine less safe, especially given the recent news of the manufacturing issues? So kind of the safety of the vaccines, and then particularly the J&J. Dr. Kong, do you want to take that, or Lauren?
Yeah, I can start. Let's start. That is definitely a very difficult question to kind of suss through. I think for me as a provider, I had these conversations one-on-one with so many of my patients. And it's actually been fun discussing it to them, because you'd be surprised, what you'd hear and the reasons why people can be afraid. No reason is too small. Every reason is valid. I think to start with is just to, just talk with your parents or talk with your loved ones about what is it that makes them worried or concerned about the vaccines. I think it's always helpful to try to understand exactly where they're coming from. Because again, if I'm being totally honest, I was a little bit nervous when I got my vaccine back in January. Actually, December. I got in December, so we were in phase 1. So I can't tell you. I'd be lying if I said I wasn't at all a little bit nervous. I actually don't like needles myself, and I always have to hold my nurse's hand whenever she gives me my flu shot every year. So I was just a little bit nervous about that, but I also knew and trusted the science and knew that that everything I was reading and everything I knew, and all my friends who were working in infectious disease or working in the ICUs, they had confidence in it too, and that gave me confidence. And lo and behold, I don't have another arm or anything. I'm feeling great. I'm hearing a lot of good data on, the vaccine and its safety in pregnant women and its safety in breastfeeding. So I think that's a great place to start, is to just find out why. What is it about it that makes them nervous? And I think another great place is just to encourage them to speak with their providers. A lot of patients have unique medical issues, and I know a lot of my patients are like, well, I have this, or I have this immune issue, or what have you. I mean, medicine is broad, and there are just so many different things that you can have, from autoimmune issues to clotting disorders. So I know that it definitely gives my patients comfort. It gives me comfort. I have patients, I have parents who are in their 60s too. So it gives me comfort to speak to their PCP and to know that they know them and they're looking at their charts, and they can kind of let me know, does my dad's bleeding disorder make it dangerous for him to get a vaccine? And it's nice to kind of be able to speak with my father's primary care doctor and kind of get that information straight from someone who has known him for several years. So that's another, I think, layer of reassurance that we can offer our patients, and something that we can use to bolster vaccine confidence. As Lauren said, no vaccine is better than the other. They're all effective. The reason for the different numbers, especially between Moderna and Pfizer and Johnson & Johnson, is simply because they were studied at different times. So just because the numbers are different doesn't necessarily mean one is better or worse than the other. It's kind of comparing apples to oranges. So it's a little bit hard to do. Regarding the Johnson & Johnson issue, I had also read somewhere, I know there was manufacturing issues, and that is causing a larger chunk of doses to basically be thrown away, which is good. I honestly think that news like that makes me more confident in their quality control aspect, because they're not afraid to say, hey, we messed up, but we're not going to send this out to any patients or any people out there, so that, because we don't want anyone to be harmed by this ingredient mess up. So that actually gives me a lot more confidence in Johnson & Johnson, truthfully. I would rather hear that they're doing the right thing than just sweeping it under the rug and sending it out to my patients. I also read somewhere in another article that the ingredient, I think the ingredient mix-up, it's not going to actually impair the supply either, I guess. So I guess they'd still have a bunch waiting in the wings. So I don't think that's going to impair our proposed plan to keep rolling quickly through our phases, and hopefully getting one in every person's arms after April 19th. So that's kind of what I'd say. I'm going to let Lauren jump in, because I know she has some thoughts on this too.
Yeah, I mean, I echo everything Dr. Kong just said, and I'll just quickly say, just speaking more about the Johnson & Johnson news that's been going on this week is, our current supply of Johnson & Johnson that's in the state, and that actually the Board of Health even has some supply of Johnson & Johnson. It was not affected by any of the news that you're hearing. We continue to have confidence in that vaccine. And exactly what Dr. Kong just mentioned is that, all products that are kind of regulated by the FDA and regulated by the federal government in this country, go through a process when there's an issue of recalling and quality control. And that's just one component of this vaccine. And it should give us confidence that that the issue was, it wasn't before it got into anyone's arms that they found out about this and fixed the problem. And as I said, we continue to have confidence in the Johnson & Johnson stock, and we'll continue to use it when the state gives it to us, because there is so many safety measures that go into making and manufacturing and distributing these vaccines.
Mhm.
Every step along the way is very, very well regulated.
Thank you both. Very good. Very good. The next question is an excellent question. Is it better to use the hospital settings with professional medical staff to get vaccinated rather than the mass vaccination sites run with the help of volunteers? Lauren, you take this because I know that you run RMA, and the assumption seems that volunteers are not medical staff. So please.
Sure. Definitely will answer the question. Everyone who is vaccinating, so every person in the state of Massachusetts who is giving you a vaccine is medically trained. And that could be it could be a wide variety of different medical professionals. Nurses are the majority of people that we use for our clinics at the Board of Health, but we also use doctors. Dr. Kong has been a vaccinator many times at our clinics. Her colleagues at MGH have also been vaccinators. We have, nursing students who have all been trained and educated in the process and monitored, and our medically trained EMTs are also, paramedics are also eligible to give the vaccine. And so there are many different healthcare providers who are able to give vaccines at more of the community clinics, for example, the ones that we run, the mass vaccination sites. And so what I would say is these vaccines are very safe. It is safe to go to sites that are not a healthcare provider for the general public. If you have concerns about specific medical conditions that you might have that might put you at higher risk for, and if you have significant allergic history, or if you have significant medical conditions to the point where you feel like you need further monitoring, it's not a bad idea to talk to your primary care provider about where to get the vaccine. That's never a bad idea. Many times, I'm sure your primary care provider will say, go get the vaccine, but it's never a bad idea to have that conversation first. But overall, vaccines, and if you get a vaccine at a CVS, my own two parents, whom I love dearly, went to a CVS, and that's okay because that was safe and effective, and everyone was following the rules. And so any option is okay, but having that conversation with your primary care provider, if you're having those concerns, is never a bad idea. And I'm sure Dr. Kong has other thoughts too. I'll pass it on.
Similar to Lauren, my dad also went to CVS. He got a second vaccine a couple of days ago, so and did just fine. I also want to point out something that Lauren said. I am a volunteer also, so I don't think volunteers are bad. I like to think I do a good job. The other thing I want to point out too is that volunteers, by definition, they want to be there. They're excited to roll up their sleeves and help out. So I love being there to help out Lauren and to help out the city and to vaccinate the community, many of whom are my own patients. I've vaccinated one or two of my own patients at these clinics. So that's something else to consider. Just because they're volunteers doesn't necessarily mean it's bad. It certainly does not mean they're not trained, but it means that they want to be there. They're volunteering their time and doing it without pay. So I think that's a really good sign. At least in my book, it's a really good sign. I echo everything that Lauren said. I want to add.
Thank you. So the next question is, in quotes, you tell us to sign up, but still no vaccines. I am 65 plus, have asthma, still nothing. How do I get my vaccine?
Okay, so I'm wondering if this person says you tell it. So again, we went over that so the ways to get a vaccine are increasing every day, right? it doesn't mean that it's going to be an easy process still necessarily. There is still some legwork, there is still some patience, there is still some kind of hunting and pecking that still is going to be happening. And so I'm hearing frustration in this question, and I understand it and acknowledge it and recognize that a lot of people still feel frustrated, and we know that. It's, you know, as a person who's given, as the mayor said, you know, we've done almost 6,000 doses now, so it's every arm and every person that rolls through, it's one more person who's kind of moved through the process, and we are moving many people through the process. But we recognize that there's still a lot out there. There's still a lot of people out there who still are feeling frustrated, and there are going there. And I know we've said this last time. More and more options are becoming available. More and more options with more and more appointments are becoming available. And so I hope that after the presentation that we gave, this question is somewhat answered in that there's East Boston Neighborhood Health Center with the Wonderland site. There is mass vaccination sites. There are CVS's and Walgreens and healthcare providers and homebound options and mobile efforts coming to you. And so I think maybe this is a problem of trying to find out where all these options are. And so in that regard, I'd say call our hotline, sign up for the information updates, and call 211 at the state. All of those options, people know about the options that are available in our city. People know about the options that are available in our state. So reach out, go online, do some digging around. If you don't feel comfortable with a computer, if you don't have a computer, if you don't like computers, call someone. Reach out because there are more and more options every day. And
I also want to point out too that just because there are more options doesn't necessarily mean there are enough vaccines. So as the mayor mentioned at the top of that hour, or at the top of the town hall, supply continues to be an issue. It is getting better every day. Getting better every day. So we'll continue to put out as many appointments as we're able to, depending on our supply. It's not a matter of if you get the vaccine, it's only a matter of when. Every single person who wants a vaccine will get it. Guaranteed, will get it. So, again, it's going to take a little bit of digging, but there are resources, especially that phone number, that hotline, which I think is so key. I live in Somerville. They don't have a hotline like that, which is awesome. So I'm really happy and glad that Revere has this option for all of my patients. So call the hotline, sign up for the updates, take advantage of the new Wonderland vaccine clinic, as well as CVS and Walgreens and the mass vaccinations across the state. The final thing I'll add is just reach out to your PCP as well, because I know every single clinic has a different process for distributing their vaccines and getting it to their patients. So you have a lot of different options. Cast a wide net. Don't just go with one. Do it all, and hopefully we'll get you a vaccine soon.
I'm just going to add one more thing here. I am here every morning when that COVID hotline, Ed plays the tape and listens to every one of those calls, writes them down, and responds to them. So I know that there's a response when you call that COVID hotline. And if not, if you feel you're not being answered, call the senior center, 781-286-8155. We are here to listen and help you. So please, there's no reason for anybody to say, we're not helping. We are. Okay, another question. So this person had COVID-19 around January of this year. Do they have to wait 90 days until 90 days have passed in order to get the vaccine?
No. No.
Okay.
Not. The reason people are saying that, and it makes sense, but the reason they're saying that is because that person who has COVID likely has antibodies from having the COVID-19 infection. The antibodies last on average 90 days. So that person does have antibodies. So it doesn't necessarily need to be a rush to get the vaccine. But if that person decides to get a vaccine and has the opportunity to get the vaccine before the 90 days are up, that is totally fine. Nothing bad is going to happen. We're just going to add even more antibodies. And I also want to mention that, like I said, those antibodies are only around for 90 days. So anyone who's received it, who's already had COVID, please still seek out a vaccine, because this vaccine will give you antibodies for much longer than just 90 days. But if you get a vaccine within that 90-day period, nothing bad's going to happen. You're going to get a sore arm and just the usual side effects that we've all been hearing about. But it's not bad or dangerous to your body in any way to get the vaccine before that 90-day period is up.
Okay. Next question. There's no vaccination clinics convenient to where I live. Will mobile clinics be available in different neighborhoods?
Yes, they will. This is something that we've always, as a Board of Health, wanted to move towards, and we're starting this week. The state, again, is also helping us with kind of mobile clinics in different areas of our city. They will be coming. Some ways that we've kind of thought about where to go. We are definitely working with the faith leaders in the community to partner with their congregations and to partner with their faith communities. And so that will be a partnership that will be hopefully starting soon. We are looking at areas where there's maybe a high traffic, like foot traffic, places where there are accessible to public transit. All of those things we keep in mind when we look for locations. We also really like partnering. So one of the things we're doing is partnering with the resource van that Dr. Kong has helped bring to our city in terms of getting people knowledge and information about the vaccine. And so we use that kind of as a guide to help pick our locations for our mobile clinics. So the short answer is yes, things are coming. The long answer is continue to look at continue to use the resources we mentioned before to find out where we're going. And I'd say over the next month and 2 months, this will really ramp up as kind of the real big push as a city is we're going to be kind of take our show on the road. And so, it should be happening more and more frequently.
Okay. When will children be eligible for the vaccinate?
So literally like 2 days ago, or no, sorry, yesterday, the news came out. So Pfizer it has begun to study their vaccines in children as young as 12 years old. So right now, the Pfizer vaccine is, you can give it to anyone 16 years and up, and Moderna and Johnson & Johnson, you can give it to anyone 18 years and up. All of these folks are studying their vaccine safety and efficacy in younger individuals. And Pfizer released some preliminary data, information on how it's going. And it's going great. It's going great. So the vaccines in their trials are 100% effective at preventing children as young as 12 years old from getting COVID-19, which is amazing. We still don't know when it's going to come out yet, because we obviously want to make sure we take our time and that we're studying every angle of this and making sure it's safe. But we do know right now it's effective, and we're also seeing that it's quite safe too. It's no more dangerous than me getting the vaccine, for example, someone who's my age. So hopefully soon. I don't have an answer for you, but I know it's most likely going to happen this year. I'm 90% sure that some sort of FDA authorization will happen before the end of the year that will allow our children to get vaccinated.
Thank you, Dr. Kong. Next question is, how safe is it, and you kind of alluded to this earlier, how safe is it to go to an indoor restaurant after I'm vaccinated?
This question is very tough for me to answer. I think I got this question before in a previous town hall. I talk about this a lot with my own friends. Personally, I have not dined indoors, mainly because our case rates in the state of Massachusetts and in certain cities is just a little bit too high for me to feel comfortable. The other thing is more of an altruistic angle. Our restaurant workers were just allowed to get vaccinated on March 22nd. So knowing that, I'm vaccinated, I've been vaccinated since December, but I recognize I'm a provider and I recognize how lucky I am to have been given that opportunity that I'm sure 500,000 Americans who unfortunately have passed from this virus wish they had. So for me, I don't feel comfortable yet. I do know, especially our own restaurants in Revere, along with our inspection department, they have gone through tremendous efforts to make their restaurants safe. They're following the protocols, they're following the social distance protocols, they're wearing masks, sometimes even face shields. I've even seen restaurants put up those clear protective barriers between tables. So I do think that if you've been vaccinated and if you aren't someone who has a severe lung disease or has cancer and are undergoing chemotherapy currently or other risk factors of having complications from COVID, I do think if you're vaccinated, it most likely is safe. It most likely is safe. All right. When we're able, I encourage you to maybe eat outside. But I know that our small businesses have been really struggling, and I want to acknowledge that, and I want to make sure that we all play a part in patronizing these places and helping their recovery later. Because I'm still getting takeout and I'm still going out to eat, at least outside. But for me, my personal decision is that I just don't feel super comfortable. My husband's not vaccinated yet either, so I don't want to drag him indoors. So that's kind of part of it. We're all in a different situation. That's just my personal situation, but it's a very sticky answer. And I apologize for hedging, because I know I'm hedging, but that's just the way I'm thinking about it personally. And I hope that can help you to make the right decision for you and your family.
So, basically you're saying, we're talking about going to dinner, maybe going to dinner with your family. What about somebody going to a 50 to 100, people are allowed now to go to 100-person event. And I've seen these things advertised, even with my seniors. What is your recommendation there? Is it easier to?
So I wouldn't go to a large gathering. Like I said, the numbers are going up. The numbers are going up. So the odds of someone being at that gathering who hasn't been vaccinated yet, who might be carrying COVID without having any symptoms, it's pretty high. And if that gathering is indoors, well, that's not as well ventilated as, say, an outdoor gathering. And that COVID can go from one end of the room to the next very easily because it's indoors. So I wouldn't recommend against that. Everything I had said before is for dinner with a family, right? Dinner at a restaurant for one night with a family, not a gathering at some sort of function hall or some other large gathering. That's not what I was mentioning before. Thank you, Deb, for allowing me to clarify. But yes, I would not do the large gatherings. It's definitely not safe, especially since our numbers are going in the wrong direction. Just the odds of folks coming in to your presence with potential asymptomatic COVID or pre-symptomatic or symptomatic COVID is getting higher as our numbers tick up.
No, thank you, because it was important to point that out. We're heading towards, we have 7 minutes left, so I have two questions. Do vaccines offer protection from variants, the variants that are happening? And if I already had COVID, is the vaccine added protection?
Do I take this, Lauren? Do you want me to take it? I've been talking a lot, so.
You can take the variants question.
Sure. So
and I'll pop on after.
Sure. So variants, yes, we are seeing that they do offer some protection from the variants. Johnson & Johnson specifically was studied during the time when we actually had variants more prominently in the United States. So we know the Johnson & Johnson vaccine does work against the variants. It's I think mid 70% efficacy against some of the variants. Moderna and Pfizer, they are. I don't have the exact numbers off the top of my head, but they likely offer some protection, but it's not 100%. So you can get the variants even after being fully vaccinated, which is why it's so important to keep wearing a mask and to keep social distancing, especially in public places, especially in indoor places. So it's so important to practice those foundation mitigation strategies. I will say though, the vaccine, even if you get a variant, even if you do get COVID, it won't be as severe. You won't need to be hospitalized. High likelihood that will prevent hospitalization and prevent intubation because you've had you've had the vaccine. So yeah, just keep an eye out. Again, our numbers are ticking up, and this could be from the variants because the variants are more infectious. You still can't get the variants from COVID, even after having the vaccine, but the vaccine is still going to protect you a lot more from those variants than if you didn't have it. So definitely get the vaccine, and I'll hand it over to Lauren to finish up the question.
Sure. If I remember correctly, the question was if you've had COVID, do you get protection from the vaccine? So remember, we know that an average, and again, an average, remember, it's not the same for every individual. On average, if you have had COVID, you have potentially could have antibodies for up to 90 days. Well, we know that the COVID vaccine, your protection lasts much longer than that. We're not sure if this is going to be a vaccine that happens every year or happens every 2 years, but we know that the protection that you get from the COVID vaccine, it lasts longer than the protection that you would get from just having COVID itself. And so, yes, it does provide protection, more protection, and it's very good for you to get the vaccine even if you have had COVID.
Let me unmute myself 3 times. Okay. Final question of the evening, which is a really good question. Does the city publish vaccination data for Revere residents?
That's a great question. We just started. And the reason we just started is because actually the state just started. And so collecting this data has taken a while for kind of everyone to kind of wrap their head around. And so we have started, I believe, just a few days ago on our website. And as you can see here, we're showing where we publish it. This will be updated weekly as the state's data is updated weekly. And so we will be continuing to kind of modify the presentation of the data, but depending on what we get. But yes, we will publish the data and it will be on our website. And, just as a quick plug there, you can see that we have a little thermometer. Obviously, we want to make sure that that filled in red section goes higher and higher and higher. And we want to reach that 100. We want to reach the 71st, but we want to reach the 100 as a community together. So we can all get back to doing the things we all want to do so desperately, including vacations, travel, seeing family members without worrying, all of those things that we all miss so much, that every single person on this call misses so much. We all want to get back there. And so that's just a little plug for keep your eye on that thermometer, and hopefully we'll see it rising and rising and rising as quickly as we can. So we're at 14.3% right now, and that number will be updated potentially at the end of the week or beginning of next week, depending on when we get our data from the state. But yes, we do, just recently.
And 70% is herd immunity, as Dr. Kong could tell us, and that's where we're headed to. But we want the 100% if we can get it. And that would be that information is on www.revere.org, and that's on our website. So it's 7:29, so we are ready to end this live town hall. I thank Mayor Rigo, first of all, and second, thank you, Lauren. Thank you, Dr. Khan. It was a pleasure hosting with you this evening. And to Revere, stay happy, stay healthy.